Hello, I'm Dr. Barken, and I would like to review a study done at the Cleveland Clinic. The name of the study is Enzalutamide in patients with high-risk prostate cancer. This study is actually for patients undergoing radical prostatectomy that are high risk and starting them within 3 months after the radical prostatectomy on enzalutamide to see how it will prevent recurrent disease in patients that have high-risk features after the radical prostatectomy, and I will go over those features when I discuss this study. So first of all, let's look here. The primary outcomes measures are time to progression, defined by serologic criteria, and the time frame here is 2 years. Serologic criteria is a PSA value above 0.4 in separate occasions at least 2 weeks apart. Secondary outcome measurements are the safety of enzalutamide and to further evaluate the number of patients that experience adverse events related to the study drug. Other outcome measures: impact of enzalutamide on circulating tumor cells, time frame 2 years, quality of messenger RNA level of cervivin in circulating tumor cells obtained from patient pre and post-treatment with enzalutamide using Veridex cell search profile. The number of patients in the study are 42. It started in November 2013 and it's estimated it will be finished in June 2015. So let's look now at the arms of the study. The experimental arm is enzalutamide, and oral therapy with enzalutamide is 160 mg 4 capsules a day. The other names of this drug are Xtandi and MDV 3100. So here is the description of the study. This is a pilot phase 2 study evaluating the clinical activity and safety of enzalutamide. It's a novel androgen receptor inhibitor in men with high-risk prostate cancer who have undergone local definitive therapy with radical prostatectomy. And let me pause here a second because this sounds already like a deja vu. I've used only Casodex after radical prostatectomy in patients that were not necessarily high-risk patients for a number of years, and it was found, this is my experience, clinical experience, it was found to be very useful, and this was given instead of what was commonly given then in high-risk patients, Lupron and flutamide, or Lupron and Casodex. I gave only Casodex. The Xtandi, the MDV 3100, is just a better drug than the Casodex. It blocks it in more places, but it's also an anti-androgen. So let's look now at the eligibility of this study. 18-year-old male and no healthy volunteers, that's the usual. Let's look now at the inclusion criteria. The patient has to understand and sign informed consent, that is usual. The performance status, he has to be in a good shape. Histologically confirmed adenocarcinoma. Patient must have undergone radical prostatectomy within 3 months from study entry and have high-risk disease defined by any of the following. So here is the list of how a high-risk patient is defined for the purposes of this study. Pathological stage T3A, T3B, or T4. That means there is some penetration already through the capsule. A Gleason score, some should be above 8, or any stage initial preoperative PSA more than 20, any Gleason or any pathological stage. Any PSA Gleason patient with 35% or greater chance of biochemical failure at 5 years, and this could be plugged into the Catan nomogram, and you have here the information. Where could you get this nomogram? It's nomograms.mskcc, Memorial Sloan Kettering Cancer Center.org, under prostate, under post-radical prostatectomy. Patient with lymph node positive, regardless of the initial PSA, PT stage of Gleason score provided their postoperative PSA 6 to 8 weeks after surgery is less than 0.4 nanogram. The patient should be able to swallow the drug. Patient must have a normal organ and marrow function. The usual here is the testosterone, the blood test, the platelet, albumin, liver function test. In the exclusion criteria, what's important to note here that they want to exclude patients with clinically significant cardiovascular disease, and there is a list here of what are the criteria that determine whether the patient has clinically significant cardiovascular disease. So where is the study done? The study is done at Cleavland Clinic, Towson Cancer Institute, and we have the phone number for the contact is George Garcia, phone number 216-444-7774, and the email is garcia4@ccf.org. I think this is an interesting phase now that we are trying to move drugs that were approved for more advanced disease to move them earlier, and in a way this is a study designed as prevention for recurrent disease after radical prostatectomy. If you have any more questions, please don't hesitate to write to me, drbarken@gmail.com. I will post to you about other studies related to enzalutamide, especially those combined with immune therapy. Thank you for listening. Goodbye.